Today, I have a privilege to have with me Dr. Zafar Aminov. Dr. Zafar is the Vice Rector of Samarkand State Medical University. Samarkand State Medical University is the leading university of the Uzbekistan. How's university handholding our Indian students and how's been your experience with Indian students?
Big responsibility because parents hoping to their kids to get high quality education as well as to be safe. We have big team of faculty members. We have very good consultants, agents. We have very good campus, like Indian food, 3 times a day, like for breakfast, for lunch, and for supper. We have very good quality food. I usually go time to time.
Do you
I
also
enjoy Indian food inside dormitories.
So I adapted to Indian spices and everything.
Yeah, I like Indian food.
All the students who are coming for medical education is related to NMC FMGL regulation. How are you looking forward for this particular regulation?
We are working and following the rules of NMC very closely for many years, and we have exchanged all the necessary documents with the NMC for proving.
So Indian students or foreign students who are coming to pursue the medical education, they can practice in Uzbekistan?
Yes, they have a right to practice in Uzbekistan.
This Indian Education Society, Student Society organized this year or last year, this was the biggest mega show in How many Indian faculties we have as of now?
About 50.
Hello everyone, my name is Anuj Goyal from Get My University. I have with my colleague Mr. Rohan Singh, and as you all know, we always look forward for opportunities to interact with dignitaries, to interact with the highest officials of the universities so as to know exactly how this university is for our Indian students. And today I have a privilege to have with me Dr. Zafar Aminov. Dr. Zafar Aminov, welcome sir. Dr. Zafar is the Vice Rector of Samarkand State Medical University. Samarkand State Medical University is the leading university of the Uzbekistan, the biggest one. This university, maximum number of Indian students since last couple of years, they've opted for Samarkand State Medical University. So with so many students studying in this university, it comes with a lot of responsibility. It comes with a lot of rigor. So please, sir, I would like to start with this question. How's university handholding our Indian students and how's been your experience with Indian students?
Thank you for the question and thank you for having me. It is not only the Indian students, we have a community of international students with a number of 3.4 thousand. And out of you, of course, the majority are the Indian students, but of course, we have students from more than 15 countries.
Mm-hmm.
So it's included like CIS countries like Russia, Kazakhstan, Turkmenistan. We have students from Turkey and other countries. And now in near future, we are having cooperation with other countries' higher education institutions. And that's why we are expecting to expand the geography of international students. So I think like next year it's going to be like around like 20 countries. We are expanding to 5 more countries in training the students. Of course, it's a big responsibility because parents hoping to their kids to get the high quality education as well as to be safe, to stay safe and to take care of their daily lives, etc. So we have a big team of faculty members, and we have very good consultants, agents who are working with the students, and they are mainly they're taking care of the administrative duties of the students, and the academic responsibilities are rely on our university. Of course, we do control every aspect of the students. During the classes, after the classes, their free time, etc. So the university has like all facilities to for the entertainment, for the quality free time spending.
Now, so the important thing at this point of time for all the students who are coming for medical education is related to NMC FMGL regulations. So now, and there are regulations which adhere to certain conditions, university specific conditions, like they should be on hospital, clinical training and internship should be this duration, and everything is, defined by the regulation, internship and other things. So with respect to Samarkand State Medical University, how are you looking forward for this particular regulation and how equipped are we in terms of our academic excellence to adhere to those regulations, sir?
Yeah, thank you for the question. Of course, it's very important when we are training the doctors. It's very important to make the students exposed to the patients, and we have every medical university has to have enough beds, so capacity of the beds, so all the students get exposed to the patients and interact with the patients. Our university have two major clinics. One is about 700 beds in it, and second one is about 250 beds in it. And our university possess around 86 departments, out of which around about 75 are the clinical departments, and majority part of these clinics are all located in the hospital. We don't have clinical departments which are not located in the hospitals. Like around 25, 26 of those departments are located in our own hospitals, and remaining hospitals are located in the city hospitals of Samarkand. Samarkand has around roughly saying about 50 major hospitals and about more than 100 outpatient departments, outpatient hospitals, clinics. So our departments are located in all those hospitals, and in total, if we get, there are about 50 to 60,000 beds affiliated to our university and where students can practice simultaneously to the theoretical training. We have been working and following the rules of NMC very closely for many years, and we have exchanged all the necessary documents with the NMC, proving that we provide enough practical training for the students, and after the graduation, they can freely apply any job, physician job in Uzbekistan, which is also a very important rule of NMC. Uzbekistan doesn't have the licensing system yet, but all the diplomas issued by the universities, it's state recognized diplomas, and with the diploma, they can apply for any doctoral physician position of Uzbekistan.
So Indian students or foreign students who are coming to pursue the medical education, they can practice in Uzbekistan?
Yes, they have a right to practice in Uzbekistan as well.
Now, there comes a very important aspect for an Indian student about the overall ecosystem in terms of fooding, in terms of accommodation. So generally students ask how far is our hostels from our campus, how safe is the campus, and about the fooding and day-to-day activities. So how universities planning or giving them the right conducive atmosphere in terms of overall satisfaction.
Well, we have very good campus. Of course, our theoretical building, where the majority part of the theoretical departments are located, is next to our main building. But all the hospital, our clinic, the hostels, the major hospitals which are affiliated to our university are located in the same area. We call it city of medical professions, because lots of hospitals around there, and medical students, 5 hostels are located in that area. It's very close to each other. It's walkable distance. Students have access to all kind of infrastructure they need for studying, for the food, and also we have very good consultants who are providing Indian food as hostels as well. So they have access to Indian food 3 times a day, for breakfast, for lunch, and for supper.
And I'll tell you, we have a very good Indian restaurant and just near to university by the name of Dostana. And very, very quality food. Even when we go for fine dine restaurants in India, we don't find that kind of quality food which Dostana really offers to us. Sir, any question?
Indian students and their parents is very focused on clinical exposure in terms of India. What facilities and hospitals for Samarkand State Medical University?
Well, as I mentioned before, previously, that we have 2 major hospitals, and also we are in very good relations in cooperation with the city hospitals of Samarkand. All the classes are divided in 2 parts. So there is like if they are going to some department, first they have a theoretical part of the classes, and after that they have a practical part where they spend time on the bedside of the patients and they practice, master these skills, and they interact with the patients, and they are very closely exposed to the all the medical records. So they discuss with the teachers all the materials related to the patients, and also we have summer internships. We have they resided in the city hospital of Samarkand in different departments. They practice there. They are truly exposed to the hospital life.
So let me give a caveat over here. Generally, students confuse the one who has not experienced the simulation. It is like a mannequin. But because I've seen the simulation centers, please understand simulation centers as a very, very complex structure.
Yep.
It's an interactive overall system whereby you have different simulators for students understanding gynecology, pediatric.
Yep.
Different models are there, and when you provide any procedure on that, then it is connected to an interactive machine that tells you whether your pressure is right or if you're doing a CPR or whatever.
We have very good sophisticated simulators. You can even measure the blood pressure, check the pupil reaction, and different things. You can also we have a modern simulators where they can master the endoscopic operation skills. They can do. We have a virtual reality simulators as well. They can interact with the patients as well. They can do almost everything.
Sir, when I look at Samarkand and when I generally overall analyze the university, I consider Samarkand to be a truly global university, international university. And this brings me to a very important part. When you go for international, then there is naturally international exams. Like you have to prepare for USMLE, FLAP, AMC, or other exams. A student just want to explore other options of settling abroad.
Yeah.
So how university is assimilating that kind of education pedagogy, and what kind of education can a student look forward in terms of preparation, and to an extent preparation of his FMG or next exam when he's coming back to India? So are we preparing them for that?
Well, yes, it's a very good point. Giving the medical education to the students is important, but again, to make the program globally recognized is very important for the university and for the students as well. It gives them more opportunity to apply for the different positions to different clinics in different parts of the world, and it makes them more competitive in the labor market. Medical labor market is very competitive, and the diploma of recognized medical university is very high value in the competition. We continuously work with that. We recently accredited our general medicine MBBS program and dentistry program. It was accredited by based on the standard of the World Federation of Medical Education, and also we passed the institutional accreditation for the provision of high quality medical education and management of the quality. And also we are recently, I can give you an example, we have got approval from the University of Pisa, which is very prominent university in Europe. And
University of Pisa.
Yes, and we agreed on mutual recognition of our diploma. It means after some additional courses taken provided by the University Pisa faculty members, they receive the diploma of that university, and automatically they will receive the right to work or apply for any doctoral position in European Union. We provide in our university additional courses where students can get prepared for a certain type of exams, for FLAP, for USMLE, for an MC exams, and etc. So we do offer that kind of additional courses, and also we have very good faculty members from India, and we usually hire the faculty members from India who passed the NMC exams and who have experience.
How many Indian faculties we have as of now?
About 50.
50 Indian faculty.
Yes.
I think so. This is a very, very important
And
point.
it is a very good important point that it gives them a very friendly, well, our local faculty member also
In terms of
friendly to-
assimilative, language-wise,
Assimilative,
understanding, because they themselves have done from India
It reduces
and
the culture
comfortable,
shock.
yeah.
It reduces the culture shock.
Cultural
when the
shock, yes.
Kids, like young kids, come to Uzbekistan and start their classes in Samarkand State Medical University, and seeing people from same country, same nationality,
Yeah.
it makes them very helps them to easily adapt into the environment, and for they can ask some advice for certain things about certain things.
And I would like to add, sir,
Cultural
because I was
things.
invited this time, this year or last year, this was the biggest mega show in Indian cultural, this Indian education society, student society organized. And this is a kind of a mesmerizing student. They should go and check our details. We have a cover this Indian Cultural Society Fest, mega event.
Yep.
And university also participating and encouraging the student in. So it is not just about academics, it's about a cultural exchange. And that's the reason this Indian Uzbek summit was more than education, it was a cultural exchange.
Yes.
And finally, sir, before we'll move, like any message that you would like to give to the students who want to come and pursue their education at Samarkand State Medical University?
It's my pleasure that Indian students are choosing my university, coming to Samarkand. It's a long tradition with a long history, because our nations used to cooperate very closely for ages, and I'm very glad that I'm witnessing and I'm being part of the new era of cooperation between India and Uzbekistan, and I'm really glad that Indian students are coming to Samarkand State Medical University, they're choosing it to get the high quality medical education. And again, in Samarkand, they're in very good hands. We, as I told during my interview, we do our best to comfort Indian students in Samarkand at our university. So if you guys choose Samarkand State Medical University, you will do the best choice ever.
Thank you, sir, for sparing such insightful learnings. And frankly speaking, for a parent and a child, they don't have many expectations. They have basic expectation. First is quality education. Second is delivery of education, the way we are, equipping Indian faculty members with them. Third is accommodation, fooding that you have shared, international education again, and the possibility of coming back to India and possibility of exploring other avenues. So thank you, sir, and thank you very much for sparing your precious time, and thank you much more for participating in Indo-Uzbek Summit 2025, because your representation was very much desired. Even Ambassador sir was especially of mention of Samarkand State Medical University. So there's a special focus from the embassy as well that Samarkand is one of the finest cities and the finest education system.
Thank you very much. Thank you for having me.
Thank you, sir. Thank you, guys. And keep following to Get My University, other videos. And if you have any queries with respect to education, feel free to call us. We'll definitely guide you to get you the finest and objective information about the medical education system of Uzbekistan. Thank you.